right, so now I'm going to call to the stage somebody who really needs no introduction. Katie Kirkpatrick, what an amazing leader in our community. Thank you for everything you do every day. So she's one of our most engaged Rotarians and serves as the president and CEO of the 162-year-old Metro Atlanta Chamber. They've got us by a few years, I guess. And 165? Oh, sorry about that. What's 3 years? Katie is known for her public policy prowess, courageous leadership, and more than a decade of driven impact through her work at the Chamber. In 2022, Katie was named one of Georgia Trend Magazine's 100 most influential Georgians, one of Atlanta Magazine's Atlanta 500, top-ranking leaders in the region, and the Atlanta Business Chronicle's 22 to watch in 2022. David, that's a nice 22 to watch. I love that. Katie, please come to the stage and introduce our speaker and our program today. Thank you.
I'm delighted to be with all of you today, but more delighted that you all are going to meet an incredible public servant, Commissioner Kevin Tanner. So Kevin Tanner is the Commissioner of Georgia Department of Behavioral Health and Developmental Disabilities. We affectionately call it the GDB-HDD, so in case y'all can remember that. He has served as County Manager of Forsyth County and served 4 terms as State Representative for District 9. He also has spent 34 years in public service, and that's on top of running multiple businesses, as I know. Commissioner Tanner received his undergraduate degree from North Georgia College and State University and earned his Master of Public Administration from Columbus State. He has been heavily involved in the North Georgia community for many years. If you ever meet anybody from North Georgia, they're going to know who Kevin Tanner is. He and his wife, Stacy, have been married for 26 years. Stacy is a public school kindergarten teacher, and they have 3 daughters. He serves as a deacon at Bethel Baptist Church, where his family has attended for 7 generations. So as I welcome Commissioner Tanner to join us on this stage, he's going to make some remarks about DBHDD, and then we will sit in a fireside chat format and then open it up for Q&A. So please welcome Commissioner Tanner.
Thank you very much, and I just want to say, Leslie, thank you for putting up about the recovery journey. That's something that our agency's heavily involved in, and we value and appreciate people who are willing to be able to speak publicly about that, because you don't know how many lives you can save. Like Katie said, I am Kevin Tanner. I have the pleasure of being Commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities, a position I've held since December of 22. Served in the Georgia General Assembly for 4 terms, had the opportunity to meet a lot of you actually in the room over the last 34 years of public service. I'm also a 25-year Rotarian, former president and assistant district governor in the Rotary organization. It's an organization that's very close to my heart. Service above self is important, and thank you for the Atlanta Rotary Club and all the work you do. Get my slideshow going here. I will just, while they're getting that up, we'll be on slide 3. One essential aspect of being a business leader is not only growing your workforce, but it's understanding the needs of our employees. And that's one of the things that we do at DBHDD, but it's also one of the things I know it's important to all of you and your businesses in the communities you serve. We are looking at how we can work together, and I've had meetings with several of you in the room, and we were talking earlier, I have some coming up. We're looking to engage you and your businesses, your employees, and to be able to serve you in a good way. But I want to real quick show you a little bit about who we are, and appreciate this lexicon helping us put this video together, and I'll play it for you. It's about 3 minutes.
Hi, my name is Nicole Jenkins. I'm a music therapist and I am DBHDD.
Me llamo José López, trabajo en la área de Savannah y yo soy DBHDD.
My name is Gregory Brown and I'm a certified peer specialist and I am DBHDD.
I'm Victoria Williams. I'm an RN and I am DBHDD.
I'm Carol Love. I serve the Augusta area and I am DBHDD.
My name is Lorna Lindo. I am a behavioral health counselor and I am DBHDD.
My name is Ming Long. I'm a nurse manager at Central Unit. I'm DBHDD.
So that just is a little glimpse into what we do, but we're more than the mental health authority for the state. We also have over 570 Medicaid provider programs serving over 13,000 individuals that have an intellectual and developmental disability, with another 7,000 individuals on a planning list that will ultimately need waiver services in the near future. We're also building the state's first crisis center for developmental disabilities. Those of you who are around the hospital system know that sometimes those individuals are getting stuck in emergency rooms. This is going to be the first of its kind in Georgia, nationally getting a lot of attention in Macon, Georgia. 16 inpatient beds. Mercer Medical is going to be contracting with us to run a very robust outpatient service center there. We're excited about the direction we're heading. One of the other things I'd like to just see a show of hands. How many people in the room have heard of 988? So several of you have. So Georgia is an effective leader in the rollout of 988, and I think it's important for you to understand what that is. It's a 3-digit number that you can call 24 hours a day, 7 days a week to access care and services anywhere in the United States. 1 year ago, June of 2023, the level of awareness, like in a room like this or anywhere in the state of Georgia about 988, was only 16%. Only 16% of Georgians had heard of and knew what 988 was. But this was somewhat intentional. 988 come online in July of 22, and we wanted to stand this up slowly so that we were able to roll this out in a way that our system could handle the call volume. We're currently taking around 20,000 calls per month into the 988 system. But with our help of our federal partners, Substance Abuse and Mental Health Services Administration, also known as SAMHSA, we're rolling out about $3.5 million in funding over the next few years to be able to increase awareness about 988. And I will tell you, it is working. In the last year, since we started marketing it, nearly 85% of Georgians now have an overall awareness of 988. Over 40% actually understand that 988 is the 3-digit number to call to get help. I want you to understand this 3-digit number can be called for because you're dealing with addiction, substance abuse challenges, or maybe someone who's contemplating suicide or just needs help with their mental health. This is available again, 24 hours a day, 7 days a week. I want to show you a real-world example of how this is saving lives each and every day here in Georgia.
I had 2 miscarriages. I ended up in a deep depression, and from there I started spiraling into substance use. I got attacked a few times. I'm trying to make money. I remember that last attack. That last attack is what sent me back to my family. And my mom, I'll never forget, my mom gave me a look like she loved me so much and she just wanted me to stop. She gave me that look like, I love you and I'm gonna accept you and I'm gonna let you back in, but you breaking my heart. And that moment right there, I said, you know what? This is it. I cannot do it no more. This is just getting out of hand. I'm gonna lose my life. Now that I'm in recovery, I have quality of life. I'm not running from the police officer because I got a warrant. I was homeless at one point in time. I have a key to my own home. Show up for my job, show up for my family, most of all, show up for myself. I hope someone would listen to my story, and at that moment, there's a shift inside and say, yes, this is it. I'm not gonna wait. There's no more one more. I'm gonna do it right now. because you can do it.
If you're struggling, help is available. Call or text 988 for confidential and compassionate support.
Let me just say, mental health, substance abuse doesn't know any socioeconomic bounds. If you know someone who's struggling, please encourage them to reach out to 988. We have teams available 24 hours, 7 days a week to help. One of the other things that we're working on currently is the Opioid Settlement Abatement Trust. Many of you have probably saw that in the news recently. I am honored to have been named as trustee of those funds. There's $638 million making its way to Georgia over the next 18 years. $479 million of those dollars are going to flow through the trust. We've set up a very robust network to be able to start reviewing grant applications. We've received over 308 grant applications in our first round that opened up in May with an ask of $248 million. We plan to roll out the first grant awards later this fall. We're going to award around $50 million in the first round of funding. So we're excited about where we're heading. We have, again, a great group of leaders all around the state reviewing these applications now. And I think there might have been a QR code there. Yes, if you're interested, if you have an organization or a nonprofit that you're on the board of that may have an interest in seeking funds, you can take that QR code. That will lead you to our website. You'll be able to stay up to date on future grant opportunities. But again, we're going to be doing that again at the first of next year. Workforce is a challenge. I know it's a challenge for all the business owners in the room. Let me tell you, at DBHDD, we're not insulated from that. During the COVID pandemic, our hospital system, we have 5 hospitals, we lost 25% of our workforce. Over 1,200 employees left our hospital system because of the competitive nature of nursing and doctors in the system. We have done a lot to try to regain that workforce, and we're making great progress. One of the things that we found is we were running about 19% overall below market pay. And in our professionals of doctors, psychiatrists, psychologists, MDs, psychologists, we were at 20% below market. We've made progress in that area thanks to the Governor and General Assembly, and just recently we were able to internally, with some changes we made, give an increase of 20% to our doctors. That includes our forensic psychiatrists, our psychologists, and our MD internists that work at our hospitals, bringing them up to market rates, which we're excited about that. We're going to continue to keep working. One of the other things I'm excited about is those of you who knew Speaker David Ralston personally or by reputation knows that he was a staunch supporter of mental health in Georgia and did more than probably any other one person in advancing its cause. I am thankful that the General Assembly honored him and honored his legacy by funding the Speaker David Ralston Center of Behavioral Health and Developmental Disabilities at the University of Georgia. This center is currently being stood up, and it's going to be a place of vision and advocacy and helping create a pipeline for the future workforce in Georgia. We cannot address all of these statistics without building a network and developing relationships. We're asking that you partner with us. These are some of the partners we have at the department that's helping us promote 988 and awareness of that. We appreciate the partners we have. I got to throw the first pitch out recently at the Atlanta Braves game. Those of you who know Mike Plant, he and I were talking on the sidelines. He's the president of the Braves, and somebody made a comment, and he said, "Wait a minute, are you throwing out the first pitch?" And I wanted to say, "What the heck did you think I was doing standing out here on the side of the Braves field?" But he asked me if I'd warmed up. I said no. He took me up under the dugout, and we warmed up with players. So what a cool experience. But Tyler, one of the pitchers of the Braves, caught the ball. He's been very open about his own depression and his own wellness journey. So we're thankful that we have leaders in the Atlanta area who are open about their recovery journey and helping lead others to recovery. I look forward to chatting with Katie. She's been a friend a long time. I appreciate what the Atlanta Metro Chamber does for the city of Atlanta. But also, if you're interested in following us on social media, I encourage you to do so. We are becoming a very robust agency that has a footprint all across Georgia, and we're on the front lines of trying to improve mental health services all across Georgia. So I look forward to partnering with each of you as we move this conversation forward. Thank you.
Commissioner Tanner, it's an incredible agency that you lead that many people in our community have zero knowledge about. And so I think that was a really good grounding presentation for us to understand what DBHDD really does for the citizens of Georgia, and also the number $500 million that the governor and the legislature have already allocated toward mental health is a wonderful statistic to talk about the leadership and how we believe that mental health matters. And so I think you have a room full of advocates here, so thank you for providing some baseline information. So one of the most important things when we talk about mental health or behavioral health is really thinking about doing things differently. And often the word that's used there is innovation. And so we have learned, some of you may have heard the term that this is the mental health decade, right? This is the time and space where we are going to be investing in mental health and behavioral health services. And so you made the comments about the investments being made by the state. We saw a picture of First Lady Marty Kemp and her promotion of 988. So talk to us about how you, as the Commissioner of DBHDD, think about innovation as it comes to our ability to treat Georgians that need those services.
Yeah, that's a great question and a great point. So one of the challenges with mental health services, if you have a family member, if you're personally needing help, is how to access this system. It's complicated, it's hard to find a provider. That's really what 988 is what I like to call the Staples easy button, if you just easy button to access care. But 988 is more than just a button to call or a phone number to call. We dispatch mobile crisis teams anywhere in the state 24 hours a day. Typically, we're able to respond in the metro area to you where you are within 1 hour. Rural parts of the state around an hour and a half. That's a licensed clinician meeting you where you are. One of the other things that we're doing is we've created what we call ACT teams. Those ACT teams are based with our community service boards. And if someone's needing mental health services and they are not able to drive, don't have a car, our ACT teams go and provide services in the home to those individuals. So we're looking at ways to remove barriers to care and to services. But building out our 988 crisis continuum is about the phone number, which we're answering calls now in less than 13 seconds, and building out the mobile crisis teams, and building out our crisis centers where people can go if they need a place to stay.
Yeah, we're going to touch on a crisis center in a moment, so I'm going to come back around to that. But you talked about meeting people where they are, right? So not everyone can access a doctor, a clinician, a hospital, psychiatric services. And so you talked a little bit about how you all can respond to where they are. So let's talk about the unsheltered population. We often understand, or maybe have been told wrong statistics even about our unsheltered population and what percentage of them are experiencing behavioral health or mental health crises. We have a large concentration, we're the downtown Rotary. We have a large concentration of unsheltered population right here in downtown. And we know that the visibility of the unsheltered population often drives a perception of what a community may be like. And so I know that we as an organization at the Metro Atlanta Chamber have been working to try and find ways to articulate why there needs to be compassionate care for those on the street, and also making sure that they get the services that they need. So we know that there's a small subset of unhoused population in downtown that are also service resistant. So thinking about DBHDD, what is the state doing to address this small but impactful portion of our population? And how do you think about that and the services you can provide?
Yeah, and that's such a tough population to provide services for a lot of reasons, but you hit on one, they're just resistant to receiving services, very skeptical of us. We do have street teams that we fund that go out and work with individuals where they are on the streets. We have one in Athens, Georgia, that worked with an individual for 7 years and was able to finally get him into recovery. He got into a recovery center, got off of alcohol, drugs, got services for mental health, and then transitioned into full-time employment and is doing great. Another lady that won one of our Hope Awards this past year, she actually is an example of the entire continuum. She was homeless. She ended up getting 1013. She got put in the state hospital.
What's a 1013?
1013 is an involuntary commitment to a hospital. She came to one of our hospitals, then transitioned to a community service board crisis bed. And then we were able to provide her a Georgia housing voucher, which we run. We have over 2,300 people currently receiving the Georgia housing voucher. Those are individuals without homes, without shelter, and who have serious persistent mental illness. Anybody that falls into that category is qualified for one of our Georgia housing vouchers. We pay $1,100 a month in rent. She got into that program, got into treatment, got into recovery. Then she went on to be trained as one of our peers, and now she's working full-time as a peer, helping others get to a place of recovery. So it's a success story. The other thing I'll mention, because you've got a famous person here sitting up front, but Jack Harden, who many of you know, a fellow Rotarian here in the Atlanta Club, I kind of twisted his arm a little bit because I chair the Behavioral Health Reform and Innovation Commission since 2019. And we created a work group this year on the homeless population that has mental illness, and I asked Jack to chair that group. And they've been meeting. I know they're going to Texas soon to take a look at some things that's happening there. Nobody solved this issue, but we are making progress, and we've got some really good people working on it, and we'd love to engage anybody in the room who has thoughts or ideas.
I hope you heard that first story. 7 years to engage with someone that is unsheltered, build the trust, and then convince them that the services you're going to provide to them are not going to go away and that they're going to be treated with dignity. And I think that's a big problem when we sit around at a cocktail party and we talk about the homeless population and why can't, things change. And the reality is there's been a lot of trauma and we have to rebuild that trust. So thank you to DBHCD for thinking about it. Quick question that wasn't in here. So you were talking about 2,300 people are using the Georgia Voucher program. Is that enough? Is your Georgia Voucher program, do we need to expand it?
So that has grown considerably over the last few years. We are also taking advantage of the federal HUD Choice Voucher program that we're able to transition people into. We're spending around $35 million this year on the Choice Voucher, on the Georgia Housing Voucher. We anticipate that we'll probably have 600 or 700 more people that will need those services in the next 12 months. So it's going to require additional funding, and we're going to continue to have to work to be able to transition people to the federal program. It's challenging. But not only do we provide the housing voucher with the Georgia Housing Voucher, we provide all the wraparound services also. For instance, the Melody here in Atlanta that the mayor was able to build with the city council, Fulton County is under contract to provide the behavioral health wraparound services at that location. We're funding that work through DBHDD. So a lot of efforts are taking place, but we still have a lot of work to do.
So that's actually an area that we as Rotarians can actually do is advocate for more investment in mental health and support for DBHDD and other services that are in the community. So if you noticed in the video that he played, there was a little short clip of somebody peeling some tape off of a window. And I think that might have been from the Fulton County Crisis Center ribbon cutting. So I'd love for you to tell us what is the Fulton County Health Crisis Center, Behavioral Health Crisis Center, and what is the role of DBHDD with that center?
Yeah, so we have crisis centers throughout the state. We recently did a study because everyone knew that we needed more, but we could not put a number to what that more looks like. So we identified we needed 8 additional crisis centers over the next 10 years. 5 of those needed to be located in the metro area. The state funded the operational costs, which is around $10 million a year for one to be constructed in Fulton County. And it was a good partnership with the Fulton County government. They used some unused ARPA funds to pay for construction, and we're going to cover the operating cost. We opened that last week. It is a 24-bed inpatient crisis center. It's going to have a very robust outpatient piece with it also. there's also dollars in the FY25 budget to start the planning for a second Fulton County Behavioral Health Crisis Center in the northern part of the county. This was the first one in the state's largest populated county, so much needed. Definitely fills one of those spots. We also will probably build one south of Fulton, hopefully in the next year, so that'll also take one of those slots.
So that's an incredible victory right here in Fulton County, and we need to make sure that we're supporting that crisis center as much as we can. So hopefully we'll learn more about that in the coming months. You talked about 988. So hopefully everybody in this room will be able to raise their hands now that you've heard the 3 digits 988. I know it's incredibly impactful. You mentioned some of the numbers that we've seen, and it just had its 2nd anniversary. And so any thoughts that you might want to share with this group about the implementation and where we're heading on 988?
Yeah, so we've got to about 20,000 calls a month coming in now to the 988 center here in Georgia. We're answering those calls in less than 13 seconds. We've had a significant investment in the 988 system. We also are creating tremendous partnerships. One has been with the Restaurant Workers Association here in Atlanta. You may not know this, but restaurant workers have one of the highest rate of suicides among their working class of any other work group. Construction workers also are extremely high. And the other group is the agriculture community. So we've initiated a program with the Restaurant Workers Association. They've got hashtag 86 the stigma, which 86 means take it off or we don't have it. And they're wearing those shirts, they're using those pins, and we're promoting 988 to our restaurant workers. We also have started the Faith and Farm initiative because in the farming community, they talk to 2 people. They talk to their spouse and they talk to their pastor. So we've engaged both of those subsets and we're having good success doing that all across Georgia. So a lot of excitement happening. There's also a lot of opportunities to partner with DBHDD in this effort.
Do you feel like you've got enough funding to adequately push 988, or do you need more? You notice I'm saying that because there's a room full of people here that have influence and advocacy.
Well, you never have enough funding because we're saving people's lives. That's the reality. But one of the things I'll just put on the table to the business leaders here to think about is how could you partner with us? How can you help us get the word out about 988? Because you all are very astute business leaders in the community, but many of you had not heard of 988. Think about your employee base, your customer base. How many of those do not know about 988? And today, mental health of our employees is so important. So I could imagine partnering with Delta, for instance, and when you get on an airplane and you see the 988 messaging on the back of your seat, some of your companies might be able to do something similar to that. We had a great partnership with the Dawson County Rotary Club where we partnered with them and they did a blitz in their community with billboards, social media ads, etc., had some speakers. So think about how your business may be to engage with us to help promote 988, not just to your employees, but also your customer base.
That's a great call out. I was thinking about trucks as they're driving down the road. A lot of room for advertising on that trailer. Let's talk briefly before I think we're almost time for questions. You mentioned the opioid trust fund that you're managing. That's a small amount of money, by the way. And I know that a lot of it has to be confidential, right? But an easily accessible opportunity. And so we've got this amount of money that has come through the lawsuit. So how does DBHDD ensure that those funds are actually impacting the lives by which opioids perhaps had a detrimental impact?
So out of the $479 million that'll come through the trust, 60% of that will be for statewide initiatives, 40% for regional initiatives. The regional initiatives are going to be reviewed by a regional advisory group that have been appointed by all the counties and cities within that region. And then the statewide is what we call the GOSAC group. Half the members are appointed by the governor, half by local governments. They're reviewing those grant applications. We're also going to have a very robust compliance piece to this too, to make sure people are actually spending the money the way they should. The other thing, if you haven't done it, you can look at the GA Opioid Trust website. Take a look at that. We've done an analysis of all the current things available in the opioid continuum of care and what the gaps of service are. And we're encouraging people to apply for grant funding to fill those gaps. So a lot of opportunities there, and we want to make sure Georgia's leading the way nationally at the end of 18 years.
And I should have added this. Did you all know that our overdose rate has gone up 165% in the state of Georgia? So that's why these funds are absolutely critical to making sure that we're protecting the lives of Georgians here. So, Commissioner, thank you, and I think I'm going to turn it over to President Adrian.
Thank you, Katie, for leading us in that discussion. Let's open it up to Q&A for members and our guests from Skyland Trail. If you want to ask some questions, please do. There's a microphone up there. Please go ahead.
Thank you. Thank you, Commissioner. I'm Leona Barr Davenport, President of the Atlanta Business League. My question, and you couldn't cover everything, I'm sure. What is your relationship, or what is the pending relationship with the police departments?
So we have a lot of good relationships across the state. We have pilot programs that we run for assisted outpatient treatment with the courts. Law enforcement's involved in that. We also have and fund co-responder programs with a lot of our police departments and sheriff's offices around the state, where we have a licensed clinician embedded with the police to go out on mental health calls. We also are actually doing some jail-based restoration inside jail facilities here in Georgia as pilots. So we're working closely with our law enforcement partners.
Thank you. And we will gladly share that information with our constituents, with our ecosystem. I think it's wonderful, and it's something that is very much needed in the city, or the state.
And I suspect we probably need more. Absolutely. Right? And again, it goes back to that more, not less. Other questions?
We've got one over here.
Yep. Is that?
Please come on up to the microphone if you've got questions.
Stuart, another retiree.
Good afternoon, yes, so one more year. Stuart Gully, I'm the president of Woodward Academy. Sadly, we learned over the weekend that one of our graduates of the class of 21 died of an overdose. Fentanyl may have been involved, we're not sure of all the details, but one of the questions I have for you is, are you all seeing an increase in a challenge with teenage mental health, and is there any special programming that you have for them?
Yeah, absolutely. Our suicide rates have increased dramatically in our young people, which is alarming. We run a lot of different types of programs. First thing we do is we have APEX, which is a licensed mental health clinician, and we're paying for 731 of those in 731 schools in the state. We also do teen summits, teen suicide summits. We're getting ready to have one of those actually down at Valdosta. We also have some clubhouses that we run in the state. Some of those are focused on recovery. Some of those are focused on young people who have mental health diagnosis. We also have a youth peer program. So it's someone who's just kind of out of that adolescent phase, who either had addiction or who has a mental illness that's in recovery, that can help young people. So we have a lot of programs around that, but it is challenging. Number one place people become addicted to opioids and ultimately fentanyl is in the medicine cabinet at home. I encourage all of you to go home and do an inventory of your medicine cabinet. If you have any medication there that you're not using, talk to your pharmacist about a proper way to dispose of it. It's the number one place your kids, your grandkids, and others are getting addicted.
Thank you.
Good afternoon. Adam Mathis, Prime Power Services. I also chaired the Committee for Homelessness with the Buckhead Coalition, and I was wondering if you could expand on what a partnership at the local community level might look like.
Yeah, that's a good question. And also, Jack y'all probably have a relationship, but I'd encourage you to talk to Jack too about engaging and involving with our task force that we have working now. So we have a lot of programs that the state funds. We have those programs through our homeless teams, our ACT teams, our CSBs. So typically, we're funding those to the Community Service Board. Fulton County is the only county in the state that doesn't have a Community Service Board. Our funding for it goes directly to the Fulton County government, so they have a very robust behavioral health system, and we're providing them funding for a lot of services, including ACT, et cetera. So you could engage with them. But I'll also say we're very open to ideas. So if you have ideas, we're working right now with Henry County on a diversion program out of jail. One of the biggest missing links is housing. And it's not so much that we don't have funding to give someone a voucher, it's just that there's no place for them to rent. And especially for our population, we're trying to divert out of jail. So we're trying to solve some of those challenges. So any ideas, anything you have, please let us know.
Thank you.
I think we have time for one more question. Thank you.
I'm Amy Dosick. I work for Cherry Becker, an accounting firm, and we have lots of young people. And 42% of Gen Z have had a mental health diagnosis. And probably it's an understatement to say that most large employers, many of whom are represented here today, have no idea how to support that population. So can you talk about what kind of resources you're developing for employers to help their employee populations deal with mental health in the workplace?
Yeah, it's a huge challenge. So if you're an employer and you have an interest in learning more about services or partnering with us in your employee base, please reach out to us. You can contact us through our website, which the QR code should take you to. The other thing I'll just say is we have a lot of experts that work within our agency that can come out, meet you where you are as an employer, and give you good advice and talk through that. But the number one quickest and easiest thing you can do is make sure people understand in your workplace it's okay to talk about it. It's okay not to be okay. It's okay to ask for help, and make sure you're promoting the 988 resource, because it's the quickest and easiest way to access services.
Thank you, Commissioner, for your noble work. So I've seen this issue affect business, clients, in my not-for-profit involvement, with friends, in the schools, and I didn't know what DBHDD was until today, and I'm embarrassed about that. But it's changed, and you've given us 3 clear calls to action, which will lead by example as we go home today. 988, talk about it. Be open about journeys to recovery and ask for help. So as a 20-year plus Rotarian, you know the power of what Rotary can do to change the trajectory of issues. Let's hope that your presence and your team's presence here today puts this front and center of what we need to do. So thank you for being here. Let's thank Katie and Commissioner. Just before we adjourn, I wanted to give you a quick preview of upcoming programs next week. We have past President Stephanie talking to former Governor Nathan Deal on early childhood education. John, with all your golfing, you might know that the PGA is coming to town in a couple of weeks. I'm sure you'll be there. And then I'm excited to talk and announce about plans for our service day in and around the election. So in early September, Secretary Brad Raffensperger will be back to talk to us about what we as a business community can do in order to make sure that that goes as well as hoped. Past President John Yates is going to be interviewing former CEO Jeff Immelt on how Atlanta can surpass Silicon Valley. We've got Judge Ludwig, we've got David Rubenstein coming, no less. We've got Admiral Dennis Blair, and then everybody's favorite, Raphael Bostic. So I hope that inspires everybody to attend Rotary. Let's take what Commissioner Tanner said today to heart. Let's go out, let's engage and impact as only the Atlanta Rotary Club can. With that, have a great week.